I am a registered nurse, and I felt that I should not have any medical problems, that I should be able to know and prevent them. And I've come to the conclusion that maybe I can help some people by telling my story. 6.5 years ago, I got a severe infection from a pedicure on my right foot. It was so severe that I was hospitalized several times. I was on IV antibiotics. I had several surgeries, and I ended up having amputation of all my toes on my right foot. And one day I overheard one of the other doctors tell my doctors that she should probably amputate my lower right leg. I said, absolutely not. I want to try hyperbaric. I started treatment, and lo and behold, my wound healed on its own, completely healed. I didn't need a skin graft, and I had the finest care, and I became a real believer in hyperbaric. I went back to work after 14 months. I drove my car again. I led a normal life, and then one day after a shower, I noticed that I had an opening on the bottom of my foot. And of course I panicked, and my memories of what happened to my other foot came back to me. This was my left foot, my other foot. And my first thought was, what am I going to do? Where am I going to go? I know I needed a good wound clinic. First I called where the hyperbaric chambers are at the St. Francis Hospital to see if there was a wound clinic. And then I found out they work very closely with St. Mary's Hospital. I met Dr. Young, and he's the director of the wound care clinic. He's also into amputation prevention. And the first thing I said to him, don't remove my toes. And he said to me, I don't remove toes. I didn't realize how serious my foot was until about a week later, when I went back and it was swollen and it looked much worse. Apparently I had a big abscess that I didn't even know I had. Since I have some neuropathy, I didn't have any feeling, I didn't have any pain or anything. And this young podiatrist came up to me and held my hand, and he said, I'm going to take good care of you. And I found out later it was Dr. Trainer, and he was a senior medical resident. He graduates in June, starts his practice in July, and I will be his first patient. I've worked all over the world with the best of the best, and this is the best of the best. I couldn't have had better care anywhere. I know it's hard to make that first phone call. It was hard for me, and I know how important it is being a nurse. When you see something wrong, especially a diabetic, and you see a break in your skin, the first step is to pick up that phone and make an appointment. We have a great wound care center at St. Mary's Hospital and a hyperbaric unit at St. Francis that work together. And I can guarantee you that you need to get help quickly if you see anything with your skin, or you have any questions that's concerning you about your diabetes. You need to call. What's hard about that step is that it's the fear of the unknown. You know there's something wrong, and I feared the worst because I'd already had the experience with my other foot, and I know that I could have lost my leg if I was in the wrong medical hands. I could have lost my leg. I'm looking forward to the future. I'm looking at maybe doing something different in my life. And the one thing, I have a great attitude, I have respect, and I have confidence in the medical profession. I've been careful who I've chosen, and I think I've chosen the right people. The best is yet to come as far as I'm concerned, and I still have my toes.